I'm Donny Lovelace, CFO of Diamond Healthcare. I'm here with Traci Gray, our VP of Revenue Cycle, to talk about the behavioral health revenue cycle and areas of focus that can lead to improvements to financial performance. So Traci, what are some common opportunities for improvements that you've seen at locations you've assessed?
Well, Donny, for behavioral health, the revenue cycle is a series of events, each with a unique defined purpose. And it often starts prior to the patient's arrival to the facility to receive services. What we find is an isolation in functionality without a full understanding of the entire revenue cycle and how those pieces fit in. So as an example, navigating behavioral health insurance payers is very unique from a coverage guideline perspective, an authorization perspective, a billing perspective. There are nuances that are very specific to behavioral health. And without having that information on the front end, then it can create some stumbling blocks throughout the process. The front end supports the back end in the revenue cycle. So we find that enforcing education and transparency for those particular items is a good opportunity for a lot of our locations.
Okay. So why are these processes so important to the hospital?
Well, the hospital provides services to patients, and there is an expectation that they be reimbursed for their services. Having the ability to ensure that your reimbursement process is solid, knowing that you've got a reimbursement model, you have the ability to do cash forecasting to determine what your services are going to be. Understanding the nuances of behavioral health is a very good model to create workflow. Your workflow processes will support the overall revenue cycle health for your organization, and it will lead into developing solid processes to help keep the hospitals compliant and improve financial performance.
Well, great. So what are some successful tips that you can offer to hospitals so that they can have a successful behavioral health revenue cycle process?
Well, the revenue cycle process is a support process. It is a true support department. So number one would be to support each one of those functions and areas throughout the course of the patient's stay with processes, and train and educate your team members. Data analytics to help identify trends and to go ahead and implement changes. Measurements, anticipating what you can expect from a financial performance. All of those things help develop a strong revenue cycle.
Okay, great, thanks. Well, thank you, Traci, for that. Hopefully this has proven to be helpful in having a behavioral health revenue cycle process.